off relatively slowly, but we estimate that at the end of the first year, we will have seen some 35 to 40,000 patients. And it's interesting to note that in the way that medical tourism is normally catered to, is for every one patient, there's normally one person accompanying them, which is normally considered an accompaniment. Right. Which means it's normally two people. It's also interesting to know that the average stay in medical tourism is 9.5 days. Okay. The current average stay, and I stand to be corrected by Mr. Scott, is I think 4.5 to 4 3/4 days, something thereabout.
Something about 4.89 or something.
Okay, so close. But it's also important to note, and again validated by Deloitte's study and Grant Thornton's, that the average medical tourist spends over 200% more than the average leisure tourist. And this is non-medical spend, not only medical spend. We believe the economics will be significant. And obviously the first phase is relatively small. We plan to go up to 2,000 beds. So you can extrapolate those figures and understand the impacts of what will happen over the period of years.
Now, Health City Cayman Islands, when we talk medical tourism, it's a wide range of services that can be offered in medical tourism. Can we speak a little bit to exactly what we plan in specializing in and the scope of things as far as services are concerned?
Yeah. I mean, Donna, I would like to step back a second and refer to something that Mr. Glidden said, and that is Cayman has created an environment for medical tourism which will allow various aspects of medical tourism to take place, not only for us but for some of the other providers. And so with that said, there is opportunity for various practices that are outside of our realm. Within our realm, we plan to start with two practices, which is cardiology and orthopedics. And that's the first phase.
Right. Okay. When Mr. Glidden was mentioning a story earlier, as far as the economy, the economics of everything, about a young man or a little child that had actually left Cayman and went to India, to Dr. Shetty's facility there and was treated. Mr. Glidden, would you care to give some background on that particular story, just so that people can get an idea of what kind of savings and benefits that they're looking at here, and what the possibilities are here in Cayman?
Yeah, Donna, and this is, when we talk about having to do our part with education, it's hard for people to actually comprehend. We only think about the costs, and we just accept those costs as far as North America. Right? So when we get quoted costs and we see, for example, that the Cayman Islands may spend, $30 million on overseas medical care, depending on what those, we accept those costs as being reasonable costs. And we have a team that obviously will work as much as possible. But I think what really brought it home as far as the savings were concerned, it was Mr. Thompson and Mr. Chandy trying to offer some of those services and setting up a charitable, or at least an attempt at a charitable offering in terms of providing health care. So one of the limiting factors is obviously the huge distance of travel, and obviously in many cases it's not possible if someone is having a heart attack. Getting them across to Miami is a significant enough challenge from a timing standpoint to make overseas medical care actually work. But in cases where it's more elective surgeries, and so we've had an exercise where we've had a child in Cayman who had a cardiac problem, and there had been a quote for somewhere in the region of between $300,000 to $500,000 in cost as a normal cost. And through Mr. Chan and Mr. Thompson, we were able to arrange for that, and some other, actually, I won't mention other names because we don't want to but some other local people involved. I think it was their employer as well at the time, or the employer of the parents, got involved. They were able to send the child over to Dr. Shed in India. and have the surgery that was necessary done. And whereas we were talking about a surgery between $300,000 and $500,000 that had been quoted in the U.S., that surgery, including the cost of travel for the child and the parent, ended up being somewhere around $20,000.
That's amazing.
Right. And again, that's one story. When we multiply that out by the needs that we have as a country, we realize just how significant this opportunity will be. And so we're excited about the possibilities. We're excited to be able to actually provide care for our people that was not possible, to provide before. One of the other things, Don, I think that is important for us to recognize is that we're not the only territory that is recognizing this. We're seeing more and more in the Caribbean, specifically in the Caribbean, where other territories, other countries, Barbados, St. Martin, Nevis and St. Kitts are looking at medical tourism in a big way, and looking at opportunities to be provided there as well. So it shows that while we may have been a bit advanced in our thinking, obviously it hasn't taken very long for others to follow and recognize the great value and opportunities that medical tourism will afford to the country.
We're going to continue our conversation, but I'd like to take this opportunity to invite our listeners out there. If you have a question or a comment or some feedback for our guests in studio this evening here on Talk with the Nation on the topic of medical tourism, please give us a call at 946-9898. That's 946-9898. We were just talking about continuing our conversation about medical tourism in Cayman, and Mr. Cline Glidden, one of our guests, mentioned other countries in the region who are now looking into medical tourism and are aware of the benefits. We have neighboring Cuba that has been practicing medical tourism for many years. Would anyone care to speak to the competition that we have so close nearby?
I think again, what we've seen that Cuba has, even from our standpoint, even from the small numbers. We will send people across for medical related care in Cuba, and that partnership is great. The fact that we have regular flights going across, and we know that Cuba is renowned for the level of expertise as far as the doctors are concerned. Even when we travel to North America, the majority of the physicians that we're going to see in Florida are going to be Cuban or from Cuban descent at least. And so the level of training and expertise in the medical field, I think, is known throughout the world from a Cuban standpoint. I think it suffers a lot. It suffers a lot from the political situation, the embargo that exists specifically, and so even being closer to North America, not necessarily able to take full advantage. But what we do see happening is that further abroad, we will see that Chavez, for example, the leaders of countries like Venezuela will go to Cuba for their medical treatment. So I don't think that is any question as to the level of skill and expertise that is available there, but it's not necessarily able to compete for the North American market due to the other restrictions that are there.
Right, and therein lies another issue as well. Mr. Thompson might be able to speak to this. While they do have the medical expertise, as far as doctors and stuff are concerned, the infrastructure is not necessarily where it needs to be. And that's, do you feel, Mr. Thompson, that the Cayman Islands infrastructure will be able to set us apart from competition as close as Cuba?
I think that the willingness of government to work with us and the matured infrastructure, including our tourism product, were the things that in a big way drew Dr. Shetty to the island. And he said that publicly more times than one.
Right.
That it's, you have to, in order for medical tourism to flourish, you have to have a strong tourism base or tourism infrastructure to support it.
Right.
Just to take Mr. Glidden's point a bit further, we've had offers from about 10 or 12 other countries to set up similar ventures. Yes, I prefer not to name them, but Mr. Glidden named a few of them that are online that are actually looking at medical tourism. One or two of those have actually been in contact with us.
Okay.
But there are numerous other countries in the Caribbean looking at this as an opportunity. And it says that we need to continue to push. We need to be the first. We need to be the best. And we need to offer the best product. And, we're confident that our facility will be a center of excellence,
right,
which will offer a very good product. But that's not to take lightly that there are not other people that will be, will be chasing behind or working at this in an aggressive manner.
Right. Mr. Scott, do you believe, and how can leisure and medical tourism coexist? How do you see that all?
The model has been proven in that at first when I heard the statistics behind the fact that, persons will travel here or to a like destination because the health care is less, then how can it be possible that they're spending so much more in regards to their actually discretionary spend when they're on island? But to Mr. Glidden's point, when you actually see the numbers and the difference between what you would usually spend for certain operations versus what you can spend in this type of setup, also doing some research, it also lends persons to then want to spend more money in the destination they are, knowing that they've gotten the surgery at such an affordable price. So that's when the information started to line up properly for me as well. So just understanding that persons, when they come here to have surgery, they have a significant other who is definitely going to take advantage of everything that we have to offer. And this is where it's also, I can understand where the political arm knew it made sense in working with Mr. Thompson to put this facility further east in the Cayman Islands, because you're now going to have additional economic activity and development that's going to develop to actually service the persons who are going to want to be in close proximity to their loved ones, even if they're 30 or 45 minutes away on the western corridor.
Right.
I'm sure they would like to be, if they could, be 10 minutes or 15 minutes away or 5 minutes away. So a lot of other leisure and recreational types of activities are going to spring up now around, and we have been for years trying to figure out how to get more persons, whether it's cruise passengers, whether it's the general leisure stay over visitor, to get them to the Eastern District, and this is going to help to solve that trick, because sometimes you say build it and they will come, not necessarily, right? But now when you actually have a steady stream of persons and demand that will be in the Eastern District, more product will start to spring up, and then from a general leisure perspective, it's going to be a much easier sell to get persons to also diversify and disperse around the island, whether it's from a cruise visitation standpoint to now get persons over there and there's more activity and more things happening in the Eastern Districts, or from a general leisure perspective to say, hey, of course now you've chosen the Cayman Islands, how about the eastern side of the island, which has its own unique charm? So I just think that there's so many different arms, and it's just going to help in so many different ways, that not only the person who is here, depending on the type of surgery that they're having, they may not be able to overtly spend time and have those types of benefits. They probably could do it a little bit before or maybe a little bit afterwards. But just knowing that this is the place that having serious surgeries such as heart surgeries that saved their life, there is that connection now to the Cayman Islands, that even if it's a year later or 2 years later, trust me, they'll be back, right? So you now have a personal relationship with visitors that you may have never gotten to come here, who are going to tell their family and friends about the Cayman Islands, who are then going to come time and time and time again, because we know if you get them here, about half of our visitors are repeat visitors, whether it's repeat visitors over 3 years. We're trying to shorten that to get them to come back every year. But they're persons who have been here before. So if we can have this personal relationship now through medical tourism, through specific procedures that have helped to save lives, we're sure that all of the benefits from that will definitely have a domino effect moving forward. And Mr. Thompson and I'm going to love to sit down, Mr. Thompson, to go over his data as well, because as you can tell, I love having a lot of research information. But when I was looking and researching online as well, in early 2000, for instance, 2000s, medical tourists spent $1.6 billion in Thailand. And Thailand's been in the field for a while, and they were famous for sex operation changes back in the 70s. That's how they started to go on the medical tourism field. But also places such as South Africa, and of course these are huge countries. 30 to 40 million was spent in 2004 by medical tourists.
Right.
We talk about diversification, and we would have spoken about South America and trying to get Latin America, and in 10 years hopefully it would have about 7 to 10% of our total visitation. In the early 90s, and I need to get my data updated, Costa Rica actually started to track medical tourists, and it actually represented 14% of total visitors into Costa Rica. We know that number has grown since, because they have great facilities there as well. But 14%. When we look at our secondary source markets, the UK is and UK and Europe is about 5 or 6%. Canada now is growing, and it's about 7%. But you look at somebody who's been doing this back in the 90s, and 14% of their total visitor arrivals are due to medical tourism. So this is where I get excited, thinking where this can possibly go in the future, where not only are we getting Latin America to become a sizable part of our total visitor arrivals and still increase U.S. visitors, but medical tourism can grow our numbers potentially by 15-20%, depending on the different numbers that Mr. Thompson has and that they're going to actually target to bring in, which is also exciting from a tourism perspective as well.
All right, gentlemen, we have to take a break here on Talk with the Nation. If you're listening in and you want to give us a call, that number to call is 946-9898. This is Talk with the Nation here on Vibe 98.9. We'll be right back.
Talk with the Nation, presented by the Honorable McKeeva Bush, returns on Vibe FM.
All right, welcome back to Talk with the Nation. If you're just joining us, our phone lines are open. Please give us a call at 946-9898. We're talking about medical tourism, trying to lay all the facts out on the table for you that you will be more knowledgeable about this topic when you should join your friends or even hear about the topic in the public domain. Again, joining me here in the studio are the Director of Tourism, Mr. Shomari Scott, Mr. Gene Thompson, who is the Partner and Project Director for Health City Cayman Islands, as well as West Bay MLA, Mr. Cline Glidden. He's also the official spokesperson on this subject for the Cayman Islands government. Before we went to the break, Mr. Scott, our Director of Tourism, was talking about giving us some stats on various countries around the world. I think it's some 50 to 60 countries around the world who are embarking on or have been practicing or have had medical tourism as an industry in their countries. But Mr. Thompson, you wanted to pinpoint Thailand. Can we talk a little bit about the stats out of that country?
Yeah, I think one of the compelling arguments for Dr. Shetty to set up a facility in this part of the world is you have to look at the world as the total spend on health care. The total spend on the world in health care right now is about $4.8 trillion, of which United States is spending $2.8 trillion. That's with about 300 million people.
Right.
So, the assumption is, or the facts are, is that there is a very large pot within close proximity to us to draw from that are looking for a very high level of health care, high outputs, extremely good service, and for a much reduced price. And that is why we believe this is such a compelling place. Cayman is within proximity to the U.S., not unlike what Mr. Glidden said. It's that cruise ship that is within 400 miles or 500 miles from the shore. In one of Dr. Shetty's first presentations he made to government, it alluded to Cayman as the ship within a close proximity, and that was a tongue-in-cheek description, but it is within proximity to the U.S. And that is a very large market. And the U.S. Right now, if you look at the healthcare debates, it is one of the hot topics going on right now on what's going to happen with healthcare. In addition to that, if you look at the statistics, the majority of the new jobs that are going to be created in the next 20 years are not the majority, but a big percentage of new jobs that will be created in the next 20 years are at some level related to or in the healthcare industry.
Right.
So we believe it's a tremendous opportunity. We believe that the U.S. is going to be a good source of patient care for us, or patient supply for us. Mm-hmm. In fact, we already have strong indications on that, and have been talking to numerous companies about supplying patients or sending patients to us. Mm-hmm. So I think that's a strong argument. There's also the opportunity for the Caribbean. The Caribbean has over some 30 million people. Mm-hmm. Have been interest from other Caribbean countries. And then South and Central America. South and Central America, the total population is, I think, edging toward 400 million people. Mm-hmm. Again, another large market. We've had significant interest from Brazil. Right. And a couple of other South or Central American countries for certain care. So we believe that based on the fact that we're in this part of the world, the Western Hemisphere, where this spend is in the U.S. alone is $2.8 trillion, that the opportunity is sitting right next to us, or we're sitting right next to it.
Right. Now, as a part of the vision that Dr. Shetty will actually maybe be referring a lot of clients from the eastern part of the world to Health City, Cayman Islands, because it's a perfect place to vacation, as well as to get your treatments and services and medical treatments and services as well. Is that something that might happen as well?
I don't think so, Donna. Okay. Dr. Shetty currently sees patients from 76 countries in his facility, and a significant amount from the U.S. I think those things will happen by just a natural event. Mm-hmm. Dr. Shetty's facility in India. His facilities in India are growing by leaps and bounds. Mm-hmm. He currently has over 10,000 beds under construction, and can scarcely keep up with the demand for health care. Right. So but the patients that would be in the Western Hemisphere, we believe, especially the Americas, would come here just because of proximity.
Okay. Let's talk about Dr. Devi Shetty. I mean, I've seen him on CNN. He's a world-renowned heart surgeon. I know that about him. But for those who are out there listening that may not know about the man behind this project, tell us a little bit about him.
Donna, I guess I'd like to say that in my life, I guess, this is probably one of the greatest honors to work with a man like him. Dr. Shetty is probably one of the most unique people. He's a visionary, mm-hmm. but he is the most kindest, compassionate person I think I've ever met. Mm-hmm. He has the biggest heart in the world. In fact, about a third of all the surgeries he does are for free. It's for people that can't afford health care. Dr. Shetty is a cardiac surgeon. He is modestly considered the world's greatest cardiac surgeon. Mm-hmm. In many circles, he's performed north of 20,000 cardiac surgeries. He still performs surgeries on an average day. He'll do 2 to 3 surgeries. He only handles very complex cases, and most of them now are pediatric. Dr. Shetty was Mother Teresa's doctor. He took care of her for her last 6 years of her life. In fact, he inserted a stent in Mother Teresa's heart. And he's become known as what his logo is, caring with compassion. Mm-hmm. But he has a vision. He has a vision that every man, woman, and child should be allowed to have health care regardless of their economic situation. Right. It is very interesting on the opening or the groundbreaking of the hospital, what he said, and when he says it is a very powerful statement, and that is that people consider him a doctor, mm-hmm. and he said, unfortunately, I'm not a doctor. My job is to put a price on human life. Because if a mother brings her child and cannot afford a heart surgery mm-hmm. because of the cost that I give them, mm-hmm. then that child must leave and die. And there's something wrong with that. There is. And his goal is to change it, not only for India, not only for Cayman, but for the world. And I can tell you, with the people that are following him and the people that are near to him and the people that are becoming drawn to this vision, it is astounding. Some of the greatest cardiac surgeons in the world, some of the greatest doctors in the world are all very closely affiliated, associated, or working with him. In fact, I'm pleased to announce that we've hired the head of our cardiac surgery for the hospital. And I cannot mention the name of who the gentleman is, but he is probably one of the top 4 or 5 cardiac surgeons in the world. And he will be joining us as our head of cardiac surgery when we open. So Dr. Shetty has endeared a lot of respect. And again, it's that caring with compassion. You know, and his vision is not about him. It's about saving people's lives.
Okay. Will Health City Cayman Islands compete against the other medical facilities here on the island?
No. And I say that in the broadest sense because we are a tertiary care center, not a primary care center. In fact, we don't desire to get into the primary care arena at all. We would like the opposite. We'd like the primary care centers to support us, and vice versa, we support them.
Oh, okay. I think it's safe to say, and I don't have any statistics on it, that heart disease and cardiac problems are largely growing in Cayman. We often hear of people having to be flown off, quickly because they've had some heart problems, and for many years. And I'm not quite sure if we still don't have an existing permanent cardiologist on island, but certainly having Health City Cayman Islands on board and in the Cayman Islands is going to be good for that sector of medicine here. Now, usually costs in Cayman, it costs more to operate in Cayman with